Hi, my name is Jeff Van Treese. I'm the CEO of Michigan Association of Recovery Residences, also known as MAR. Welcome to the approximately 25 and soon to be 50 Michigan operators of recovery residences on this webinar today. And this is the first in a series of regular webinars that we plan on having in Michigan on a monthly basis to talk about things such as basically all things that a recovery residents like. So we'll be talking about things like the regulatory environment for Michigan recovery residence operators, as well as the national environment landscape. We're going to be talking about potentially some research that's being done. We're also going to be talking, and we've got the inventory of all of our NAR experts here today. Look for emails from Kayla Hall. Kayla Hall is the Special Projects Manager at MAR in the future for times and dates and how to attend the webinars. Before we get started, I'd like to acknowledge and thank the efforts of the Michigan OROSC office, the Office of Recovery Oriented Systems of Care, for providing the funding that allows us to provide these types of webinars, best practice webinars. And those of you who listened to the NAR virtual seminar had the pleasure of listening to Angie Smith-Butterwick and Logan O'Neill from the Michigan's OROSC office. So we have a bunch of support here in Michigan. We feel lucky to have that. Today, I'm pleased to announce that we've got two individuals from the recovery residence spectrum to come and talk to us today. One is going to be Beth Fisher Sanders. Beth's got over 30 years in the field of addiction recovery. She was the founding president of NAR and is the primary author of the NAR standards. Beth operates recovery residences in Atlanta, Georgia, Greenville, South Carolina, and Charlotte, North Carolina. Also joining us this afternoon is Katherine O'Hare. Katherine has been in the recovery addiction business for over 20 years. And is the Chief Compliance Officer here in Michigan for recovery residences. So with that having been said, I'd like to turn this over to Katherine O'Hare.
Thank you, Jeff. Trying to share my webcam here. Today we're going to be talking about the new COVID-19 guidelines, and Beth is the one that's going to be reviewing those. These are the new guidelines from NAR, National Alliance for Recovery Residences. After Beth has presented that, there's going to be an opportunity to do questions and answers. Kayla will be reading off the questions and Beth will answer everything to the best of her ability. The next step would be the site review expectations. I'm the face that you'll usually see when there's a site review, and I'll be reviewing some things that I'm seeing and some things that I expect to see moving forward. There'll be a question and answer at that time too. If you have any questions, please type them in the little question area. We're not doing any of the raising of the hands. Sometimes it doesn't always work out, and there can be a long lag time with nobody speaking. So if that does happen, where there's 10 seconds or more with nobody speaking, then we have volunteered Kayla and Jeff to sing Christmas carols for everybody. So that will be fun. So we'll talk about future trainings, and he did briefly. As trainings come up, Kayla Hull will be notifying everybody. We'll give you at least 2 or 3 weeks notice minimum. So you have an opportunity to schedule that time on your computer. And then we'll go through some COVID guidelines conclusions. There's a lot of attachments available for you. Feel free to print any of those off, as well as we have some postings. Some places have postings, some don't, but these were a couple postings we came across, and Kayla helped to create them a little differently for your use. So I'm going to hand this off to Beth so she can take over and actually review the guidelines with you.
Thank you, Katherine and Jeff, and hello, everybody. I'm Beth Fisher-Sanders, and I'm so happy to be with you today. I am a provider, and I told Katherine and Jeff that I thought I probably needed to approach this conversation with you all from that framework. I am the NAR Standards Chair and facilitated the writing of the NAR COVID guidelines, and I'll tell you a little bit about that. But what I'd really like to do, because this material, the guidelines, to do a thorough review would take several hours, and we don't have that. But I woke up feeling very clear on 2020 being my most challenging year as a provider. And I've been in the field for, like Jeff said, over 30 years. I thought I had seen everything. I've never seen this. And so everything was new this year and challenging, and at times really scary, at other times really invigorating, really high highs with the wins and really low lows with the losses. So I'd like to just talk to you more anecdotally, and we'll have time to answer questions about the specific standards, but I'd like to share some of my experiences, give you some of my thoughts. I do want to give you an intro for the COVID-19 guidelines that came out pretty quickly when this crisis set in. The NAR Board of Directors felt very strongly that we needed to provide clear guidance and assistance to our affiliates and providers to know how to deal with this thing that none of us have ever seen before. We looked very strongly at the CDC guidelines, and I want to emphasize them. I look at them almost every day, if not every other day, just to see what's new. They have specific suggestions for group homes, which we certainly would qualify in that criteria. It's been a very helpful resource, and some of the guidelines that you see in the NAR COVID-19 form are shaped by them. So do look at them regularly. If you don't, that would be my first suggestion. Give you more background about the history of the guidelines. Everybody on the committee is a provider, so we were sharing very quickly our experiences as providers. I serve roughly 60 people over 2 cities. So they're larger communities, which in itself was challenging. I also operate in apartment homes, and the examples I'm going to give you are my examples. Some might apply to you, hopefully most will. Some won't. As with anything else in recovery, take what you like as far as the experiences and leave the rest. The guide itself is meant to be a compendium to the national standard. What we discerned as a committee is that every standard had implications when looking at COVID. So we could apply all of the 31 standards with the exception of 2. So 29 of the 31 standards had COVID implications to them. So how you read the actual form, we tried to keep that simple, with the left side being the actual standard, how it actually reads. The right side is more of the discussion around the requirement. What do we as NAR issuing this national standard need to see from a provider in the wake of this crisis, this epidemic that we've been in? So that's the basic format for the guidelines. Now, at the heart of it, at the heart of really all we do, is this social model. Now, that might be a new term for some of you. If you've gone through standard certification, you're probably pretty familiar with it. But how I think about social model is that it's all of the things that we as providers do to create and sustain healthy communities. In fact, what we do is create ideally a healthy family of choice. And I use family very intentionally. If we are in recovery, most of us have had some kind of negative experience, dysfunction, maybe even trauma in our families of origin growing up. So the healing aspect, and this is what keeps me coming back to the recovery residence industry. I love what I do because it's an opportunity to heal original trauma, to create the family that maybe we never had. Whatever we do has a positive implication and impact for those we serve. And that is especially true in the face of this crisis that we're dealing with. Community is everything. And our communities have been especially challenged. And hopefully this COVID guideline gives you some practical guidance to help our communities. So let's jump in with all of that. And the first guideline that we have is about entry. So that's really the best place, I think, to start. And entry protocols have, for me, changed markedly. What has changed the most is the time frame. Used to be, if somebody called in the morning, they could be coming through my door in the afternoon. That's not true anymore. We still work as quickly as we can, and if the referral source or the individual can provide evidence of being symptom-free, exposure-free, and come door to door from where they are to our residents, then we can move them fairly quickly. But the process is much, much slower, and we're much more careful. We ask a set of, I'd say, about 10 questions to the individual seeking our help. We ask for collaboration if there's a referral source, or corroboration from a friend or family member. Because as much as we want to serve the individual, what I have learned over the years is that when we look at community over here and the individual over here, my job as the administrator, as much as I want to help the individual, I've got to weigh the scale towards the community. My first priority has got to be the community, and that community that's already there. As much as I want to save the world, help the individual, I gotta take care of that community. So the way I protect the community, and what NAR asks the individual provider to do, is be very thorough in your entry protocols. Ask direct questions about COVID exposure. You might opt to have the individual have a clear negative test. Many providers are opting to do that. We are not, NAR does not ask for that specifically. We certainly recommend it, But what we do insist on in our standard is that your individual can demonstrate to the best of their ability and through corroboration that they are symptom-free and exposure-free, because you do not want to have somebody that has symptoms coming, and you can't actually have somebody that's manifesting any kind of symptoms come into your residence. By the way, we do want to see all of our residents with thermometers, that needs to be a part of the entry protocols. And a bit of wisdom around thermometers, that there are all different types of thermometers, and you as an individual provider need to find the one that is best for you. But for some of our residents that have had trauma, the thermometer gun that goes to your forehead can be triggering. So check that out before you take a temperature, if that is your thermometer instrument. That's a piece of wisdom that I've learned. And for our women's homes, we serve men and women. Many of our women ask for a traditional thermometer, and that's fine. We absolutely get that seeing a shape of a gun at your head can be a little anxiety provoking, a lot for some. So bear that in mind, and do slow down your entry protocols and have written entry protocols that take COVID into consideration. Another piece to back up even further, that there is a fair amount, if you turn on the news, of politicizing and controversy around COVID itself. And I don't really want to speak to that, but what I do want to speak to is the idea, our experience with denial in our individual residents, that I have heard several residents over the last 9 months say, well, I'm not sure if this is even real. The denial mechanism for those of us in active addiction, we know, is profound. We have an ability to think things away, to compartmentalize, and that I have absolutely seen applied to COVID. So when somebody is in that mindset, I have learned not to go into a debate about, is this real or not? I have gone into a conversation about consideration, about how disease, whether it's flu, cold, any kind of communicable disease transmits, and why having a mask is just basic consideration and a demonstration that we care. We are entrained when we're in active addiction to think only about me. And so much of what we do in our recovery residences, that's another beautiful part of this community living that we provide, is it teaches individuals to think beyond themselves, to interact and learn how to interact in a healthy way with consideration. So when you consider the masking and frame it as a way to say, I care, people are receptive. Anybody can get with that. So don't negate the power of denial, and don't get into the debate. Meet your resident where they are, but also insist that they wear a mask according to your protocols. Now, it does not say that they have to be masked inside. We do not say that specifically. We do say that you need to have a policy about it. Now, there are as many different recovery residences, all different types, hundreds, maybe thousands of different types, from the largest house that can accommodate 50 people to large hospital type environments, hotels, individual small houses. But at the end of the day, folks, we are creating families. So if we're in a larger space, probably a good idea to have a mask. If you are exceeding 10, which in many states you still cannot have a group that meets with more than 10, but for me, even in my group meetings, if we are exceeding the individual apartment, which can accommodate 4, but we do a lot of group meetings with 10, which is our minimum. If we're exceeding the apartment, it's a mask. And that's just preventative for us. That's an individual consideration. But until there is a vaccine, that's what my administration is comfortable with. Katherine, feel free to jump in because there might be some Michigan requirements that I'm not aware of. Each state has its own requirements and are at different places with managing COVID. So if there's something I'm saying that you have some insight for Michigan specific, feel free to chime in.
I will do that.
All right. Social considerations. We're a week out from Christmas and holidays, and a big hurdle that we had to get through as a staff team was considering passes. Passes have been a huge deal for recovery residence providers this year, and I guarantee that all of us have had to modify in some way. At a minimum, we've had to take in extra considerations for pass requests. And for that matter, even before holidays, who do we have in the residence, if anybody? Do we allow visitors anymore? Many residences have opted not to, but we have to remember, and what we educate our residents around is that when I have somebody come into the residence, a visitor, that person has potentially been exposed to an unknowable amount of people. And if I have 4, 10 people in my residence, however many, those people are exposed to that individual's 20 people that they've encountered that day. And that's how this disease spreads. It's exponential. And which is why many residences have gone to a no visitor policy, or passes only outside, or no passes. No one way to do it, but it needs, again, to be a policy that is clear, written, and consistent. So the variables to consider when you're looking at outside passes are, where are they going? Are they going to a family home? Who is there and how many? Have those individuals been isolated or diminished in their people interactions the way most of us have been? Are they using public transportation? Are they flying on a plane? Are they going to out of state that might require a quarantine? Lots of considerations, and for us, every pass request has warranted at least 20 to 30 minutes of discussion to sift through all of those variables. We started asking for Christmas passes before Thanksgiving so that we could have ample time to weigh it all out, talk with family members, everything. It's been very complicated to consider those things with all the variables. age of the people that are in our residence, as well as the age of people that they are visiting. You know, 65 and over are very much, I'd say, quarantined. For the first time in my life, I'm not seeing any of my family, parents, anybody, because they're all over 65 and are being careful. So those things have to be considered with our residents. Other things to consider are the fact that this is what we're doing right now is a life skill. This is life skill in the wake of adversity. And that's so much of what we help our residents with. I think of recovery residents are the day-to-day application of life skills, of recovery life skills. And so that is so much more heightened now with amped up anxiety and stress and much more limited social interactions. How do I cope when my traditional coping mechanisms, like meeting with my sponsor every week, going to my favorite meetings every day, and those things are not available anymore, are not available in the ways that we're accustomed to them. So we as providers are stepping up to fill in a lot of those blanks, maybe providing in-house meetings, maybe having much more interaction with our residents. I know many of you in Michigan are level 2s with where you are the direct providers, and probably your workload with direct care has easily quadrupled. No question in my mind about it, because everything is just so much more in society and in us. Our feelings, our experiences, all of it is so much more. And we are having to actually get down on the ground to scrub the kitchen floors with our residents, because cleaning protocols have increased. And you'll see that reflected in the standard, that we want to see daily cleaning protocols in place, that the virus or many airborne pathogens actually can live for a period of time on surfaces like kitchen counters and light switches and things that you can touch, and especially if you've touched your face and then touched a light switch. Viruses can continue to live. So the cleaning protocols are very important. Many of our residents pre-COVID didn't know how, or had to learn again how to clean. So we are actually showing a key life skill of cleaning, and in these times, enhanced cleaning. Other life skills like how to get a job. Well, that was hard enough before COVID, wasn't it? But now seeking work, well, for some of our residents, especially those with felony records, that's just been extremely difficult during COVID times, because jobs are so much more scarce. However, we have been able to partner in both our cities of operation with different volunteer sites, and especially food pantries. There's a real need for volunteers at food pantries, and that has been a saving grace for many of our residents who have had difficulty getting work, that it gives them a purpose, even if it's just a couple of times a week. It's something they look forward to, getting outside, interacting with people, masked of course, and still gaining that life skill as well of some kind of structure and schedule. Another life skill that has been very helpful this year has been in increasing our exercise, our group exercise and our individual exercise with our residents. That we do some life skill counseling one-on-ones. A lot of times those are happening outside walking, it gives them that activity, because left to our own devices, might stay inside, especially and this was true in the beginning. For almost 90 days, our residents didn't go anywhere to speak of. We'd go sit out on the porch, or we'd go to a picnic table in the complex, or go to a park. Those things really opened us up, our awareness up, to the importance of just moving our bodies, just moving, the walking. Some of our residents even started running again and found that that was great for stress management. So exercise is a really important consideration for our communities. Even just weightlifting or jumping jacks, seriously, calisthenics, push-ups, super helpful. And you know, when we're stressed, we also tend to look at food for comfort. We've had some great experiences with family dinners. We have regular family dinners. We've had that all along, but they have absolutely increased in frequency. And because we've been inside, we've done great cooking classes. At first it was the staff showing how to make sauces or even boil water for spaghetti. Some of our residents didn't even know that, and taking it from the beginning of the meal, from the shopping to the actual cooking. Those things have been wonderful this year. The increase in residents' ability to actually cook, not just microwave. We used to have a lot of microwavers. Today we have a lot more cookers, which has been wonderful, especially for our young adults. Our young adults, I've beefed for many a year about microwaving, and they're actually starting to cook, which has been wonderful. Another family-oriented thing, life skill, social model, has been game nights, finding fun things to do in the house. We've had a lot of puzzle making. We've just done just about every board game that you can imagine, and with Christmas coming, we're looking forward to replenishing our stock of board games. And again, those things happened before, but they happen so much more now because we're so much more mindful of needing to make home a safe, comforting, want to be at home place to be. And so we've been very intentional about creating that atmosphere. And game night, self-care night. For our women, we've done nails. For our men, it's been more movies or video games. But those things happen a lot and make home a nice place to be. So, you know, while COVID has been so challenging and stressful in many ways, there are really great things like family nights at home that have come out of it. I think we're a much better organization for it. So much more mindful, and I'd like to think so much more skilled about it. Other considerations. I mentioned earlier about trauma, and that I don't think any of us work with purely substance use recovery anymore. I think we are all providers of co-occurring recovery residences, because most, if not all, of our residents in substance use recovery have some kind of trauma in their history. And what we know about trauma is that stress exacerbates it, makes it worse. So what I have seen with my residents is that the frequency of needing psychiatric intervention of some kind, i.e. med evaluations, and at times assessment for higher level of care, not because of a reoccurrence or relapse, but because the stress level and anxiety is so high. In a couple of cases, it has made residents delusional. Things like that might occur with more frequency. And I would also caution you to be on alert for warning signs of that through the holidays, because many of our residents aren't going to be interacting with their families the way they're accustomed to. For some, that's a good thing. But for others, it's another loss, and it's grief, and it's feelings that I don't quite know what to do with. And when those feelings go unexpressed, well, anything we tamp down, it's like a volcano. It's got to come out somehow. And sometimes that can be in a crisis. So don't be afraid to ask the questions. And most of all, trust your gut. Boy, that's something I have really learned in so many years of this work, is that if I feel something is off for some reason, it generally is. So don't be afraid to ask the question, because I've never regretted asking a question, but I've regretted many times not checking out something. So asking a question of how are you feeling, or are you thinking about hurting yourself, or are you thinking about using, any of those pointed questions. Questions have never made anybody do those things. Questions give me permission to actually talk about something that maybe is only a fleeting thought. But if I express it, it takes the power out of that thought, and I am so much less likely to act on it. The last thing, because I know we're getting short on time, is I really want to speak to you, the provider, about your own self-care, and if you have staff, their self-care. It is critical that we be in integrity and do the things that we are asking our residents to do. Now, our standard from day one has had several standards that imply that. I think we give good guidance on self-care and working with our own staff, expecting from our staff recovery-based ways of interacting with residents, as well as our own self-care. But that's critical now. I don't know a provider that has not been impacted financially. I absolutely have, and CARES has saved the day earlier in the year with cash flow, because our census has been impacted. For all that there is a increased need for what we do, sadly, there's decreased resources to do it. So residents that could have come to us 9 months ago financially are unable to do so now, and I don't have the resources to supplement it. Like I said, I'd love to save and help the world, but I don't have those resources to do it. All that to say that yes, it's not only been stressful for our residents, it's been incredibly stressful for all of us. And we have to have breaks. And hopefully you have an ability to take breaks, because we can't give from an empty well. We have to keep filling ourselves up, and we have to be mindful of that throughout this collective experience that we're having. So rest, exercise, all of the life skill suggestions, those apply to us as well. And whatever helps you to feel peaceful, calm, cared for, whatever fills your tank, do it, and do it regularly. So as I said, we could talk a lot more, but I do want to hear from you and hear your questions and your experiences, and hopefully some of what I've said has been helpful to you.
So far, it looks like we only had one question. If anyone has any questions in the next couple of minutes, feel free to send them in. The one that we have received so far is, should we be having any new residents be COVID tested prior to entering the program?
It's never a bad idea. And again, it really depends on variables. So the first variable is exposure. Okay, what is the exposure potential that resident has had? Example, if I'm getting a resident directly from a detox facility where they've been at for 10 days and they have been COVID tested there, and they are coming directly from there to my home, not stopping, not pass and go, coming directly to me, then the urgency of having that clear test, especially if they already have one within the last 10 days, is not there. However, if I am coming from my mom's house and I've been working at my Starbucks or construction job, and I really want to be in a supportive environment because I haven't been able to put days together of recovery, then yeah, I would definitely suggest a test. They have to demonstrate that they are COVID free is to the best of your ability. That's what you owe your current community, is their safety. Another suggestion too that I want to raise is that many of us, as far as exposure goes, don't have single bedrooms. Most of us have shared rooms, and keeping the head distance apart, many providers have gone to alternating head to toe. So if I've got side-by-side beds, I'm looking at the toes of my residents in the next bed. As much as you can keep that 6 feet apart in your home in a family-oriented, safe way, the better.
We have one more question. It was said, Beth had talked about more family dinners at the recovery residences. Wouldn't that require more trips to the grocery store? Would this not create more potential exposure to residents?
Boy, that's a great question. So yes or no. I mean, we have had lots of use of Amazon, of delivery options. It really depends on your comfort level. We have promoted intentional grocery shopping. You know, the grocery store was a saving grace for many in the beginning, me included. It was besides work, it was the only place I could go. So I would go once a week and load up at the grocery store and do it very safely. And I still go to I don't wear the gloves anymore, but I do carry hand sanitizer bottles on me at all times, always mask. There is a way to be in the grocery store safely. And in the states that I operate on, they insist on masks and they insist on 6 feet apart. And yeah, the potential exposure, I suppose, is higher, but we have to eat, we have to have food, we have to go to the grocery store if we're not ordering. And some of our residents don't have the ability to do that, so, or the resources to do it, because it can be a little bit more. We've had some of our residents use Fresh Express. That's a great service. Whatever, and certainly an abundance of Grubhub or delivery services, which are also very safe, that there's no interpersonal interaction. So there's lots of ways to do the family dinner time to meet the safety needs of you as an individual provider and their comfort level. Our residents have different levels of comfort in the face of this epidemic. Our older residents do tend rightly to be more wary, and our younger residents do tend to be more reckless. And that is when our staff teams come in and do that life skill education, coaching around just being safe.
Patrick also added that he believes that Walmart pickup is very safe, no added cost, and they put it in your trunk for you. So that's also an option.
Great suggestion. Yeah, and I've found that actually most grocery stores have that option.
All right. Well, it looks like that's all the questions we have right now. Feel free to continue sending in questions. Remember, we're just having them typed and sent right now. We're going to answer them after each topic, so we're not going to have anybody raise their hands or unmute anybody. So, all right, we'll move on. Katherine?
Okay. Hello, everyone. Yes, I'm wearing a mask. The next segment is about site review expectations, and this is one thing I expect. I wanted to thank Beth so much for reviewing the new standards, and I hope that was very helpful for people. I think speaking to you as an operator, I think the way she presented it was much more realistic, in a way to hopefully help you gain some more tools while we're all going through this. So, site review expectations. I'm the face typically that you're going to see walking through the door. I will have gloves on, and I will also be wearing a mask. And so my expectation when I go to a recovery residence is that the operator, whoever's doing the walk around with me, will also be wearing at least a mask. I request that only one other person walk around with me. I do have another person that comes with me, but at this time I have him sitting in the car. So there's not too many people doing the site review. I want to allow for that social distancing. So one thing that I see sometimes is the operator's got it down like this. Well, that's not how you wear a mask. This is how you should be wearing a mask. Or they're like this, just covering their nose. So, so it's important that everybody wear the mask properly and keep that social distancing. I also wanted to remind everybody, and Beth touched on that too, is we need to be the example that we ask the residents to do. So we need to be the example we want to see. So if you have a rule where you need to wear a mask when you're out of your room, when you come into their home, you should be wearing a mask as well. Minimum I want to see as well is a signage, maybe on the outside of the door before they even walk in, that when you walk in the door, please make sure you have a mask on. There should be maybe some clean masks hanging in a baggie or something when they walk in the door as well. You ask them to wear a mask, but maybe they don't have it. So you can buy them in bulk at many different stores. Pharmacies have them as well. I think it's important if we're asking them to do something that we actually help provide those materials. I would like to see hand sanitizer. So it's important that when they walk in the door, that they have a way to wash their hands. And then maybe some signage and policies in place. You use the hand sanitizer, then you go to the bathroom, and you also wash your hands and dry your hands properly. So some of the things that I've seen in some of the homes that I liked so far as some of the rules are, when you're in the home in common areas, they ask that you wear a mask and keep a mask on. But when you retire to your room, if your own personal room, you can remove your mask. I thought that was great. But there's many different homes, I understand that. But if we ask somebody to do it, it's important that we provide the tools for them as well. Another thing I want to see is cleanliness. There should be a cleaning routine in place anyway, a chore list, an expectation of cleaning their own personal environment there that they live in. But with COVID, it's even more important that there's additional cleaning in place. That should be an expectation. Someone should be following up to make sure that this is actually taking place. Beth talked briefly, I'm going to go off subject a little bit, about, there was a question about going to the grocery store, that kind of stuff. Some places, what they've done is they've kind of made a group outing of it in the past, where several people want to go and they get groceries. During this time, it might be a better idea to have one person assigned to going to the store. Maybe a staff person can go instead of several different people to help with less exposure. I also want to remind everybody with a holiday here, holiday time can be very difficult for the people that we work with, but now we've got COVID on top of it. So that's going to make things even more difficult for many more people. Again, because Beth touched on that as well, they're not going to be able to see their family. We got to be creative on different ways that can help them. Maybe a lot of places have computers, have laptops in their home, and that's allowed the residents to actually do like a Zoom or some really important that it's at least 60% proof. That's what they're saying. I've heard from some operators that they don't like the smell of it. They don't like the fact that it smells like alcohol. There are ways you can help that if you want. You can put a few drops of essential oils in that, or there's actually some oil for like candles that can make the scent smell differently. You can pour some of that in there as well to help with that. Let's see. I wanted to let everybody know too, I went ahead and reviewed what the current toll is. As of yesterday, regarding cases, there were 4,024 new COVID cases reported here in Michigan. That's just in one day. There's been a reported 450,000 reported cases year to date, and there's been over 11,000 reported deaths. So unfortunately, many of us have known someone or had a close friend or family member that have experienced this illness or have died from it, and it's a scary time. It's a scary time for all of us, and your residents are going to need even more support during this time. So We're running out of time here. Are there any questions for me, Kayla?
Let's see. It doesn't look like we have any questions. I'll give someone, we could wait a minute to see if we get any, but also any questions that don't get answered or any questions that are thought of after the webinar, feel free to contact me. I have that page of the PowerPoint up right now with my contact information on it. Just feel free to email me with any questions that didn't get answered or any questions you thought of, and we'll definitely get back to you. One thing I'd like to
everybody. Go ahead.
One thing I'd like to remind everybody of is we have maybe 20 or so of the operators that still haven't sent in their COVID guidelines. So we definitely want to make sure we get all of those in before the start of the year. We need to be sure we're doing our part to make sure we limit the spread of this virus. So anybody who does not have these guidelines in place or has not signed it and sent it back to me, please do so before the end of the year. I'll be sending out maybe at least 1 or 2 more reminder emails about it. But let's make sure we do that.
Okay, I was just going to remind everybody about the handouts. There's 5 handouts up there as well. A couple of them are actually postings that you can put in your home. And if you don't already have something in place, I really think it's important that you have some postings in place in your home. Everybody's kind of doing something a little different, but looks like Jeff's on here now. I'm done with my portion. Again, if anyone has any questions, feel free to send them in to Kayla, and we will be sure to get back to you with the answer for that. I appreciate everyone visiting us today on our first GoToWebinar.
Just a reminder as well, all of the documents that we had involved in the webinar today, they're also on our website, michiganarr.com. Every single attachment from the handouts to what we reviewed today is going to be on the website for you to get at any time as well. So make sure you get these postings.
I have a question for Kayla.
Yes.
I heard a rumor that this might be available on a YouTube channel. Is that true?
Yes, absolutely. This is our first webinar and it's going to be a first of many. And so we are definitely going to be starting up a YouTube channel soon because all of these webinars automatically record so anybody can view them at any time on our soon to come YouTube channel.
Yay.
Yes. It's getting close to the end of the hour, so that's the end of our initial webinar. I'd like to thank Katherine. I'd like to thank Kayla. It's still on. Thank you, Beth. Having said all of that, everybody have a wonderful holidays, and we'll talk to you next year. Bye now.
Wait, it just looks like we got one more question before we close off. It just said, it sounds like it's in our best interest to avoid passes for residents over the holiday.
It's really encouraged. We just have to be more mindful right now. A lot of places that I've been going to, they've already cut back on passes, and maybe they have a policy now where they're not allowing visitors in the home. Beth's idea, I think, is a great one. Try to do your homework ahead of time. If somebody wants to go home on passes, is this just with like one family member? Are they going to be around a group? I think you have to look at each case on an individual basis. And at the end of the day, remind the person to, even though they're around family, doesn't mean that they're safe. So they should still be wearing masks and keeping the social distancing when they go on vacation. So there's no black and white answer there. Unfortunately, it's a lot of gray areas, but again, take it on a case-by-case basis and see what works best for your home and for the individual.
Awesome. Well, again, any additional questions that anybody thinks of, feel free to email me at any time. I will get those answered. We also have a follow-up survey. So when you close out of this webinar, make sure before you close out everything that you answer the survey. It also will give you an option to think of any topics that you might want to discuss at any future webinars. And just a little feedback info of what you thought about today's webinar, what we could do to improve, that kind of thing. So please make sure to answer those and send that in.
Thank you, everybody. Have a nice holiday. Stay safe.
Merry Christmas.